Dear students, welcome back. In the previous session we have discussed about the abdominal muscles. Now in this session we are going to see the inguinal ligament. This inguinal ligament is also called as Paupart's ligament, which is formed by the lower border of the external oblique aponeurosis. So this ligament is formed by the lower border of the external oblique aponeurosis, which is thickened. So the lower border of the external oblique aponeurosis is thickened and folded backwards on itself. So like this inguinal ligament is formed, and it extends from the anterior superior iliac spine to the pubic tubercle. Okay, extension of the inguinal ligament is from the anterior superior iliac spine of the pelvis to the pubic tubercle. This is the extension of the inguinal ligament. And this ligament lies beneath the fold of the groin, and it is having two halves. One is lateral half and the medial half. The lateral half is rounded and oblique. This one, lateral half, is rounded and oblique. The medial half is grooved upwards. It is having a groove on the upward, and it is more horizontal. So the lateral half is oblique, but the medial half is almost horizontal. Now coming to the attachments of this inguinal ligament. So to this inguinal ligament, the fascia lata is attached to the lower border. So the fascia lata is the deep fascia of the thigh, which is attached to the lower border of the inguinal ligament. Traction of this fascia makes the ligament convex downwards. So the fascia is attached at the lower border of this thing. When there is any traction of this fascia which causes, so like this, the traction of this fascia causes the convexity of the inguinal ligament. Okay, now the upper surface of the ligament. So this is about the lower border attachment. The lower border of the inguinal ligament gives attachment to the fascia lata. Okay, and the upper surface of the ligament gives origin to the internal oblique from its lateral 2/3, and it is another muscle is also originating from the lateral aspect, that is transverse abdominis from its lateral 1/3. 2/3, lateral 2/3 gives origin to the internal oblique muscle, and lateral 1/3 gives origin to the transverse abdominis muscle, and the cremaster muscle from its middle part. Cremaster muscle is originating from its middle part of the inguinal ligament. Okay, now coming to the relations of this inguinal ligament. The upper grooved surface of the medial half of the inguinal ligament forms the floor of the inguinal canal. So this medial half forms the floor of the inguinal canal, and this lodges the spermatic cord or round ligament of the uterus. So the spermatic cord, which is seen in males, whereas this round ligament which is giving support to the uterus. So this part of the inguinal ligament, that is the medial half of the inguinal ligament, lodges the spermatic cord or round ligament of the uterus. Okay, these are the relations of the inguinal ligament. Now coming to the extensions of this inguinal ligament. So for this ligament it has some extensions. One is the pectinial part of the inguinal ligament is called as lacunar ligament. So this one is the pectinial part of the inguinal ligament. This is the inguinal ligament and this one is the pectinial part of the inguinal ligament, which is called as lacunar ligament. So this ligament is triangular in shape. So it is triangular. If you observe this thing, it is triangular in shape. Anteriorly, it is attached to the medial end of the inguinal ligament. So anteriorly, it is attached to the medial end of the inguinal ligament. Posteriorly, it is attached to the pecten pubis and it is horizontal in position, and this one supports the spermatic cord, and this apex is attached to the pubic tubercle. The base is directed laterally. Okay, it forms the medial boundary of the femoral ring. So this forms the medial boundary of the femoral ring. Here you can see this superficial inguinal ring is present here. Okay, and this one is reinforced by the pectineal fascia and by fibers from the linea alba. Okay, this is about the pectinial part of the inguinal ligament or lacunar ligament. And the next extension of this inguinal ligament is the pectinial ligament itself. The previous one is the pectinial part of the inguinal ligament or lacunar ligament. Now the second extension is the pectinial ligament. It is also called as ligament of Cooper. So this one is the pectinial ligament. This is an extension of inguinal ligament. So this is also called as ligament of Cooper, which is an extension from the posterior part of the base of the lacunar ligaments. See here, this pectinial ligament is an extension at the base of the posterior part of the lacunar ligament. So like this pectinial ligament is formed and it is attached to the pecten pubis. So this pectinial ligament is attached to the pecten pubis and it may be regarded as the thickening in the upper part of the pectineal fascia. This ligament is regarded as thickening in the upper part of the pectineal fascia. And the next extension of the inguinal ligament is the reflected part of the inguinal ligament. Here you can see this one is the reflected part of the inguinal ligament. So it consists of, the reflected part of the inguinal ligament consists of fibers that pass upwards and medially. So it passes upwards and medially from the lateral crest of the superficial inguinal ring. So this one is the superficial inguinal ring. Here you can see this superficial inguinal ring and it is having lateral crest and this one is the medial crest. So from this medial crest, this reflected part of the inguinal ligament runs upwards and medially. It runs upwards and medially from the lateral crest of the superficial inguinal ring. So Here you can see this dotted lines here also. This one is medial crus and lateral crus, and these fibers are running upwards and medially from the lateral crus of the superficial inguinal ring. It lies behind the superficial inguinal ring and in front of the conjoined tendon. So this conjoined tendon is formed by the fusion of the lowest aponeurotic fibers of both internal oblique and of the transverse muscles attached to the pubic crest, and it is also attached to the medial part of the pecten pubis. So this is called as conjoined tendon. So this reflected part of the inguinal ligament lies behind the superficial inguinal ring and in front of the conjoined tendon. Its fibers interlace with those of the opposite side of the linea alba. So these fibers interlace with those of the opposite fibers of the linea alba. So this is all about the inguinal ligament. In the next session we are going to see the rectus sheath. Thank you.